excited to be here with you guys today, here in person as well as those joining online. Thank you very much, and thanks to the Center for Healthcare Innovation for inviting us to provide this presentation on the grant that we received back in November of 2017 on a project called Collaborating to Improve Health Services for Children in Teen Empowerment. I wanted to start this off in the right way with the land acknowledgement. So we are gathered here on Treaty 1 territory, which is the original lands of the Anishinaabe Cree, Oji Cree, Dene, and Dakota people, and homelands of Métis Nation. So with that, I want to acknowledge the many First Nations, Métis, and Inuit people whose footsteps have marked this land for years prior to us being here, and also to honor the elders, both past and present. I've also been telling this acknowledgement to acknowledge my own role as and I think in acknowledging this, it just allows me to reflect on the lens, or part of the lens, that informs the work that we do. We also thought we would start with the thank you, because it often gets put to the end. So we'll introduce ourselves in a moment, but just really want to acknowledge all the youth, young adults, parents, been involved in this work through various spaces, so the November session and the work that we'll describe that has happened since that time, as well as our team of clinicians and researchers that have really helped. So I'm Kristy Wittmeier. I'm a physiotherapist and a researcher. I hold the Dr. Jonathan Chair in Research in Pediatrics and Child Health here at the University and at the Children's Hospital Research. And I've been working in the chronic pain for youth since late 2016, early 2017 with Dr. Gerhold.
Yeah, my name is Gerhold. I'm a pediatric rheumatologist by training. And I came here already with kind of an interest in chronic pain and established a clinic after clinic in October 2015. And since then has been growing. Yeah. So we are at the moment. It's not officially funded, as many of you may know.
Okay, and we'll talk a little bit more about the clinic and the work that's come before and after this stage of the project. I also just want to let you guys know it's not just the two of us, obviously, that you'll be hearing. We are very grateful and fortunate to have the voices of two youth who were participating in that November session that will be able to hear through this presentation. So big thank you to the youth, and we have one of our young adults actually doing the presentation. All right, so like I said, that the title of the project that we were initially funded through a PREPPP award, a patient engagement award, collaborating to improve health services for children and teens. The objectives for this talk today will be to describe the approaches that we used in this family engagement workshop. We're going to describe some of the lessons that we learned. So it's not all great, but they're all lessons. You don't get everything right the first time, but I think that's when you learn most. And we do still have some questions about persist, so I think we'll bring that up as well. And we just love to hear some involvement from people in the room or online who've gone through these type of engagement sessions as well. Maybe we make headway in that direction. And we'll talk about some of the key outcomes from that day, where we've got since, and where we have our sites set for this.
Yeah, before we start with this project, I would like to introduce you a little bit from where we are coming from. There's actually an overall pain initiative at Children's Hospital at the moment. It's called Every Child at a Time. And we have a vision to manage children's pain much better than we do at the moment. It actually became a strategic priority of the department in 2017 to raise awareness of the importance of pain management, prevention, and treatment, to provide tools and recommendations for adequate management of all kinds of pain, so not only chronic pain, but also procedural pain, needle drops, for instance, pain related to acute injury and disease, and pain and cancer. We want to provide education on pain assessment and management for physicians, nurses, but also for our patients and families. And we want to conduct clinical research, and actually that is what we already started. And we want to achieve child-kind certification Foundation. Child Cancer non-governmental organization which is advocating for pain management. Chronic pain is something many people don't actually know that it happens in kids. We know that about 20 of 100 children of the general population are infected by chronic pain with or without an underlying headaches, abdominal pain, and major sites. And it becomes a disorder in about 5 of 100 children. And this has a huge impact on these children's and families' lives because children often cannot do sports, cannot go to school, and miss a lot of their social life. The estimate of about 10,000 were affected, children affected in Manitoba. And the issue is that we know if we don't do it, if we don't manage this pain adequately, we know that it may persist into adulthood. So we are running a clinic at the moment that is not funded, and I will talk a bit later on that we will need to apply for funding. It's an urgency coming up right now.
Thanks. So with that context and that background, when we applied to Center for Health Innovation for this patient engagement, what we framed the grant in saying is that we wanted to understand, with the family's input, what we should be researching to improve health services. So that's always our ultimate goal, was improving health services for youth and their families. But what should we research specifically, and then how should we conduct this research? This grant, it was about a $2,500 grant at this time. It was really our first step at engaging with this population, with these families outside of the clinical setting, and moving it into more of a research partnership. We used a couple of main approaches within the workshop. We started all together as a group, so there was 13 families that ultimately came, and we had at least one youth and one parent from each family, and sometimes 2 youth or 2 parents from the family. But 13 families came, and we started off together, just a little bit of conversation in terms of what were our hopes for the day and expectations. We tried to introduce, I think, the length of time that research can take, as well as a little bit of the process, so that we know that things don't happen as fast as we'd like them to sometimes. And a lot of our actions eventually depend on the success we have with different funding bodies when applying for research grants. We also went around the circle, and the families were expressed a little bit about themselves, as well as what they hope to achieve as well. So then we split into 2 different groups, 2 different spaces, 2 different facilitators. The parent engagement piece was led by one of our colleagues, an occupational therapist, researcher, and clinician with experience in chronic pain. And she walked us through, or walked the parents through dialogue, facilitated flip charts, sticky notes, talking about what people really wanted to see come out of the day in terms of what to research and how it should be researched. With the youth, we worked with an art therapist, and we started the session with drawing, and we used the tree of life concept. So they were asked to go through various stages with the tree to talk about where they came from, what their experiences and their life are at this time, what's working well, what gifts do they have, what gifts do they have to offer, what people are there to support them, what type of things aren't working that would be better if they weren't there anymore, and how we might move forward. We'll hear a little bit more about the tree approach later on. I'd say it was successful for some, but it was also a point of learning, definitely on our side. And there was a pivotal point after we had discussed the drawings as a group, where one of our young people said, what are our parents doing right now? So, well, your parents are talking. We went through a facilitated session, and the comment was, well, can we do that too? So, yeah, absolutely. We did that. We opened it up, and I think that was the rich conversation that really led to a lot of the outcomes that we pursued after the fact. So you can see I'm just planting a little bit, but that was a point, a turning point in the engagement there, where things opened up and we had a really rich and in-depth conversation. So I said there's two youth perspectives that will be presented throughout the presentation, and this one, the perspectives are quite different. This one was quite a positive experience, I would say. This young adult now says, for the 5 years since I was 14, I've been to multiple doctors and was told I would have chronic pain for the rest of my life. I thought I was the only one. At the workshop in November, I realized I was not the only one, and that the pain clinic was listening to all of us youth with chronic pain. Since that life-changing day back in November, I've been part of multiple workshops and a research project starting as a youth and now as a young adult. Throughout every meeting, I see the positive changes being made through the pain clinic, and the team makes sure that the changes are headed in the right direction by asking for feedback. So this young adult has stayed involved with us quite a bit since that day and has been in research projects as well as on research projects as a team member, and we've had a lot of positive outcomes together. I'm going to jump back and forth a little bit between the youth perspective and processes, what we learned, just to give due diligence to both of their stories. So at first glance, and with that positive experience in mind, what did we learn? Process-wise, we learned that we're better together as clinicians, as researchers, with the families, walking together to understand how we can improve health services through research. And we also heard, based on that last youth's comment, how important that meaningful continued contact is. So she was able to remain engaged with us, and that, I think, was a very big predictor in how she's perceiving the interaction that happened that day and the interaction. Something that we were quite aware of, I think, earlier on was that age range considerations become pretty important. So we didn't want to leave anyone out of the engagement. We kept the age range quite broad. So we had it from 8 years up until 18 for the youth. And of course, parents could be engaged. But for the youth portion, it really was impactful in that it's a very broad age range. And to have activities that are specific to such a broad age range are quite difficult. So that was something that we learned in that more immediate. I'll talk about some of our other learnings. But I'm just going to flip to our audio here. Hang in there with me. We tried this out and it worked. So we're hoping.
When I was invited to the family engagement workshop in 2017, I was so excited to finally have an opportunity to give my input on my needs that were not being met and share everything I had learned through my experience with the healthcare system. I felt such a disconnect between what I needed and any resources that were available to me. I felt empowered that I would finally have some control over a situation that I had felt so powerless in for so long. But when I arrived and found out the extent of my involvement would be an art project that virtually had nothing to do with my chronic pain at all, I felt that the point was missed entirely. I thought this day was going to be everything I had been hoping for, but instead I was drawing a tree. My eyes filled with tears and I shut down. I felt shaky and weak. All I wanted was to be asked about what my life was like with chronic pain, where my journey through countless departments of healthcare and therapy had left me. So today, I will tell you what I would have told you if you had asked. Living with chronic pain is a teeter-totter between accepting your circumstances and still keeping the hope to search for new ways to cope and manage the way pain affects your daily life. Especially upon diagnosis, it is very difficult to reach any sort of mental conclusion about how to react. How should one feel when they discover that there is no answer to their pain? I was shocked by the lack of resources accessible to me, not only as a chronic pain patient, but as a young one. This was a period in my life where I felt absolutely enraged, disheartened, misunderstood, alone, resentful, and worst of all, physically in pain. My whole life, I thought that pain was your body telling you that something was wrong. And it's supposed to be. The body's way of saying, hey, pay attention to me, right here, something's wrong. So even after learning more about chronic pain, it was very hard to ignore my body and try to understand that test after test, there was nothing visibly wrong with me. Wasn't this sort of suffering reserved for the elderly and the severely ill? I looked totally fine. I could still do a cartwheel and a handstand. Of course, I had much to learn about invisible suffering and the struggles and limits that would come along with it, but this was really how I felt at 13 years old. As with mental health issues, chronic pain is unseen and often misunderstood. Most times, when I tell someone I have chronic pain, they begin to ask me if I've seen this type of specialist or tried that type of therapy. They rack their brains for suggestions and offer me their condolences. But what they don't understand is that I'm not asking them to fix me. 6 years of doctor's appointments, back braces, massage contraptions, creams and medicines, physio regimens, and psychological treatment haven't been able to fix me. If I'm telling you about my pain, whether it's a simple complaint that my pain is really bad today, or a more thorough explanation of my feelings, there are only a few reasons I'm telling you. 1, I'm having a hard time and just need someone to talk to about it, or I just can't suffer in silence anymore. 2, I am trying to open up to you and help you understand me on a deeper level. 3, I am trying to explain why I've missed something or why I'm behaving a certain way so that I don't come off as lazy or disinterested. I have been made to feel badly about my attendance at school, even after explaining to my teachers that my chronic pain sometimes keeps me home. I've been told that I don't look so good as my eyes glaze over in class and I can't focus any longer. I've been told by my gym teacher that I need to figure it out because in real life I won't be able to take the time off. When I tell people about my pain, I wish they knew that I'm not asking for their pity. Instead, I'm asking for compassion, an ear to listen, or arms for a hug. I wish they knew that I don't need to be told to try my heat pad or to take it easy. I need to be told that I'm strong when I feel weak. I need to be told that I'm strong for doing so much while feeling this way. I need to be reminded to have compassion for myself and to forgive myself for having limits. I wish they knew the disappointment I feel in myself or in my daily productivity, how I want to do more, but sometimes it just feels so impossible. I want to be asked about how I'm doing. It doesn't have to be a sensitive topic. By asking me how I'm doing, it helps me feel less alone. If they could only take the time to consider what it's like to be in my shoes and live in pain every day, like really consider what it would be like and the mental strength it takes to live with and accept that. No one really knows how I feel because even I don't know how to fully vocalize it, but I wish they tried. If they did, I would tell them that sometimes I feel like I'm walking around with a bag of sand on my shoulders. I would tell them that it often feels as if pain is pumping through my veins from head to toe, as if someone has tied all the muscles in my back into a giant knot and is constantly tugging them towards the floor. I would tell them that sometimes I feel like I'm walking on fire. Sometimes my neck is in so much pain I can barely stand to hold my head up on my body. Sometimes my ankles feel so swollen I lay in bed with ice packs wrapped around them and don't move for hours. Sometimes my face and head hurt so much it feels as if I've been beat up or my brain is trying to escape my head. I would tell them that it is always some combination of these feelings. There are no days off. And if you were to look at me, you would have no idea. I would tell them that I try to be strong, but sometimes it all hits me that I can't escape my pain and that there is no foreseeable end. I begin to feel trapped in my own body, overwhelmed by a panicky feeling, like I can't breathe. I don't know how to channel these feelings. I can't go to the hospital. There's no medicine that I can take, no stretch that will make it all go away. Not even for 5 minutes. This body is my home, and I would be lying if I said that I wasn't terrified of a life filled with pain. I would tell them what it's like to look at your parents and tell them you're in pain and watch them look back at you helplessly with no idea in the world how to help their child, to see them struggle and to want to hide that burden from them. I would tell them that chronic pain is like a negative lens put on my life, often filtering each event in a glass half empty manner. I would tell them that it really is every day and all the time. I would tell them that it drains the life right out of me and leaves me feeling like a zombie going through the motions of my day. I would tell them that chronic pain is an amplifier on any other discomfort like being tired or sick, making these feelings almost unbearable. I would tell them that I can never enjoy the feeling of good health. I always feel like there's something wrong with me. When I go to the doctors, I wish they understood what it was like or at least that I felt like they tried. To some of them, I wish they could just tell me to my face that they don't know what to do, instead of sending me on a 3-month wild goose chase just to land me 3 months deeper into my pain with no progress in sight. I wish, when they referred me to another specialist and told me it would take 2 months to get in to see them, they knew that the only thing I could think about was what I would do tomorrow morning when I woke up in so much pain I could hardly get out of bed, let alone fathom going to school. I wish they knew that just because most days I am a functional human being doesn't mean that my quality of life isn't compromised. That just because I can touch my toes and I'm not failing school doesn't mean I am okay. I wish they would listen to my cries of help. I wish they could understand why another clear scan or blood test only fills my eyes with tears. I wish they could think of a more graceful way to break the news to a 13-year-old child that they have chronic pain and that they don't know what to do. I wish they had more answers. I wish they knew how aggravating it is for that child to go to the doctor complaining of constant pain, and the only treatment they receive is to sit in a circle and draw their pain on a gingerbread man and do mindfulness exercises on an app. Not that this cannot be helpful, but that was it. I wish the psychologist would stop telling me that I need to learn not to catastrophize and to change my negative thought patterns to good ones. It's not that simple. I need to be approached as an entire human being, mind and body. Ask me about the way my chronic pain seeps into the different aspects of my life and help me manage them. Ask me how it affects my relationships. Ask me how it steals from my identity when I can no longer participate in the things that were once very important parts of my life. Ask me about my feelings. Ask me what I think might help. Addressing these types of questions is what can lead me to a better quality of life. I have spent years feeling as though the healthcare system has failed me, that they have nothing to offer me. Jumping from doctor to doctor over extended periods of time does little to nothing for my benefit, especially when their contact is non-existent to minimal. I feel like everything that I have been able to figure out, anything that works for me, has been my own discovery, and that each only helps a little. This needs to change. Imagine if I could meet all these people in one place, an all-angle approach, if they were all educated about chronic pain, so that they could address it right away and not to allow it to get worse, so that I could feel as though my treatment plan was intentional, practical, and effective, and most importantly, designed for me and my specific needs as a child. We need to put the tools into the hands of young people to make a difference in their lives. No child should have to wander down the lonely path that I have for the past 6 years. What I am doing today, sharing my personal feelings and emotions, my story, it's a scary and vulnerable thing to do, but I believe it is so important to vocalize it so that other kids don't feel alone. The worst thing is to have all these feelings and feel so much shame surrounding them because you don't think they are normal, thinking you're too young to have these thoughts or feelings, thinking that no one will take you seriously, being told you will grow out of it, feeling shame for having a hard time or for not having figured things out already, feeling shame for needing help, not knowing how to communicate with other people our age about it. We need more resources and platforms that share this unique perspective of navigating chronic pain, all while navigating the self-discovery that is growing up.
Like we just need a pause. I want to thank young adult who recorded this for us for her powerful and great words. While we who don't live with chronic pain can never really know what it feels for the individuals living with it, she has given us the gift of her perspective and really underline the importance of working with families to improve healthcare systems for these kids. I'm really grateful too, actually, that we had to do this presentation because we have lost contact with this young adult, since our November workshop. And while you heard the positive response from the first youth that shared her thoughts with us, this one was a little bit more difficult to hear. So when we emailed out about this presentation about a month or so ago and said we're looking for families' input, if anyone want to have something to say or come present with us, and And these two people ultimately ended up sharing their perspectives. So we're really grateful to her for reaching out and to hear how she's been feeling about that day. It was very hard to hear, but very important to hear. And I think it was equally important that we can share what we heard that day and what we've done since, because I don't have the right words for it, but I think it's just allowed us to connect in a really wonderful way at a really good time to not come full circle, but something like that, right? It was important for us to reconnect at this point in time. So just to build on the lessons that we had learned from that day, we can never engage too early. So I said this was the first time we had engaged with our families outside of the clinical space. We could have engaged. You know, it's you can never start too early, right? Just knowing what might work, what might not work, how that art project might bring back feelings for some kids of something they experienced in a different group that was not very validating. So never engage too early to understand what's going to work in a certain setting with a certain population. I think we have to know that we won't get it right every time, but hopefully we'll keep getting better at working with families and bringing the right tools, words, and spaces to make it a comfortable and empowering place. But even so, we'll probably not always get it right for every person, and that's something I think we have to acknowledge, but it's important enough work to continue. I'll go back to that message of consistent and regular contact that really helped our other young adult who said maintained as part of research teams now. That I think was lacking here, and probably for lots of reasons. From the researcher, clinician side, it's been tricky to walk this tightrope of not bugging the families too much. You know, hi, it's us again. But giving enough information so that they know what we're hearing, what we're doing. And also, just jumping a bullet down, this mixing of clinical and research has been very challenging for both of us and our team as well, to respect privacy issues. How do we communicate with families in a way that is adherent, respects privacy, but isn't a barrier to authentic, frequent enough communication? And that's one of those things I think we're still grappling with, being that we see some of these families as care providers, and then we want to talk to them as researchers to know how to do things better. So just plant the seed. If we can maybe have a future session with REP, our Research Ethics Board, and some privacy people from the different institutions, I think it would be a really fruitful conversation about how do we do this in a way that adheres to all the institutional policies that are meant to protect families, while allowing us to communicate in a way that can also be protective for families. And then there's a really important point that one of our team members brought up as well. When you're the clinician and the researcher, or a clinician, even if you're not directly working with this group all the time, and a researcher, how do you walk that line between engaging with families and being therapeutic? Recognizing that engagement for research can be therapeutic, but you're not necessarily offering therapy at that time. I think for both the researcher, the clinician, and the family member, that's another tightrope to walk. And certainly in the studies that have followed, I know there were a couple of times where I looked at my colleague who was facilitating, like, what do we do? How do we jump in therapeutically in this moment? We can do something in this moment, and we had to kind of remind ourselves that this wasn't the venue for that. So it's another tightrope to walk.
Actually, can I add? I think I would like to add one thing. As a physician, it brings up another barrier between, or there's a natural barrier, I think, between the patient and the physician very often, compared to the physician and other healthcare providers. And in a research project like that, where you want to get opinion, sometimes I wasn't quite sure as a physician, you know, is it the right thing to do to be involved in this or not? To be, you know, so to let the youth actually speaking what they want to say. Do they have any kind of restrictions when I'm doing that? So that was a big thing for me as well.
I guess to that end, you didn't come and attend a lot of our, some of our sessions, specifically to allow for that space to be there for people to share their honest opinion. So to go back to that original CHI grant, we had asked about what should be researched and how this research can be conducted. And this was a really interesting point in the conversation with the young adults who provided the audio clip. And we had that first phone call, and I said, well, why don't you tell me a little bit about what your experience was? And within the first couple minutes, minutes, I could tell by the words, like, when I first started, I felt. When I heard I could do this, I felt. I thought, oh, okay, this is not going to be a super glowing experience. But what was great was, as she shared a version of what you heard over the phone, I thought, but wait, we heard this. We did hear this. And wait, what you're saying right now is actually what informed everything that followed from that November workshop. And you can see here some of the words, the top one is from the first youth, but the rest of the words are direct quotes from this audio clip that was presented. We heard each of these in our audio clip, but we also heard it on that November day. And what we heard on that day in November, really, the youth provided us with a roadmap of how we should go forward with research to improve healthcare services. So I was shocked by a lack of resources available. Asked me what I think might help. And we need resources and platforms that share this unique perspective of navigating chronic pain, all while navigating self-discovery that is growing up. The grant that we put together after the November day hit these points. So first, we recognized that the youth voice needs to be heard to design health services as well as research. We heard that, resources are lacking for healthcare providers, youth, parents, teachers, and friends. And we heard that youth felt isolated even when friends and family were around, but chronic pain in itself is isolating, and youth are the experts. And they want to talk to and hear from other youth living with chronic pain. So luckily, we were successful in submitting to the Health Sciences Center Foundation for a grant titled Let's Talk Pain, where we structured the project around those three themes. We brought youth together between the ages of 14 to 18, and we're about 3/4 of the way through this project now, to discuss their experiences with chronic pain, but also to review some of the available resources and make recommendations for youth both clinically as well as on our website. So to address the issue of ask me what I think might help, we used a youth council format where the youth are the researchers, the youth are the experts, and they're coming together to provide their input. We're doing less talking and more listening. And the lack of resources is the major focus. So youth are reviewing some available resources on chronic pain to use, as I mentioned, both in clinical use as well as on the website that I'll show you in a moment. And that feeling of I thought I was the only one, the youth council format allowed youth to meet with others to share experiences and thinking about how else we can share experiences going forward. So one of the major activities that we did was to look at the current Every Child, Every Time website, and there is a specific resource page related to chronic pain, and that was one of our days. This study was focused on reviewing the wording that we're using, reviewing the resources that we're recommending, and thinking of ways to better use this platform as a platform for the youth voice and for sharing resources. Like I said, this research is still ongoing. It's been informed entirely by that November session, and we're really excited to share the outputs from that day, or from this project rather, as they come.
So what's next? We are fully aware that we need to have a full team to provide care for chronic patients. The goal of chronic pain management is to improve all domains of function and daily life. And it's supposed to follow a biopsychosocial approach, model of illness. It should address the body, the mind, and social aspects of chronic pain. And I think that our young woman who presented the audio actually summarized that so well. I almost cannot explain that better. So we need a team, and this team needs to have guidance by the patient, by the group. And a team approach means not what we're doing currently, that we send patients from one to the other, but it means actually that we are working together for the same goals. So if I send somebody, for instance, to physical therapy today or psychology, everybody has its own goal, right? And this is what needs to change. So the clinics that are currently existing and what we are approaching for is to have a team that we use the guidance person and involving physiotherapists, occupational therapists, psychologists, and social workers all together. So we are currently applying for a service with involvement of all required healthcare providers, and we engaged our youth. We had in one of the meetings it came up now that we have a little bit of an advisory group, and we asked them to review our application. Their suggestions were actually implemented into the briefing note, and we got letters of support from youth and parents. That's the clinical part. I think what also came out was that we were able to reach out to wonderful collaborators, and one of them is Dr. Roberta Woodgate. She's a Canadian research chair in charge of family engagement here. And we applied together with the youth for a CHIR application, where we want to study the connection between chronic. And then we want to engage on a national level, and that's what's running at the moment as well. We applied to become a SCIP member. SCIP is a National Knowledge Mobilization Network. It stands for Solution for Kids in Pain. And it's funded by the Network of Centers of Excellence. And their goal is to bridge the gap between current treatment practices available and what we actually know, what the evidence base is, how to treat and manage children's pain. So it's a national network, and we applied.
I guess stay tuned is the message from some of our future plans. We hope to have more to share. So I'll just wrap up with 2 slides, again with the youth perspective on how things are now. So from our first youth, as I watch the pain clinic evolve for the good of its patients, I feel proud to have had multiple opportunities to have my voice heard and to watch the pain clinic grow. It is so important for the researchers to ask us, the ones who are living with this horrible pain for the rest of our lives, for the answers on how we want to be treated and what we need to have for that life possible for us. It makes me so happy that the researchers are listening and showing that what we say matters. It is empowering for me to be able to help change the life of future youth with chronic pain. As a young adult, I hope to continue to help and be a part of many research projects in the future because I remember feeling like I was the only one.
After reconnecting with some of the healthcare providers involved with this project, I was more than excited to learn that my feedback from the Family Engagement Workshop in 2017 was heard loud and clear, even if I left that day feeling discouraged. I wish that day I had been brave enough to say all that I have today, but I feel a million times better after learning about all the plans they have in store to improve the young lives of chronic pain sufferers in Manitoba. I respect their selfless efforts to stand up for us and to take our feedback in all its forms. This has been a learning experience for everyone involved, and I can see that they have found the voice of youth living with chronic pain. I feel empowered and hopeful today to share my story. This is so important because it's not just about me and what I have been through. It's about all of us and the different ways we are all affected. We are by no means finished, but this is a giant step in the right direction, and it fills me with hope that I have not felt in a very long time. We cannot and will not be ignored.
Thank you very much.
Thank you.
Are you open to questions, or would you rather?
Sure.
Yeah. Anybody feel free? Thank you so much.
How did you find your youth advisors? How did you collect those people together?
Yeah, I came actually out of this first workshop.
How did you find them for that workshop?
That was right clinic, and that was part of the fee of privacy dance that we had to do, and it probably extended our start date a little bit. I don't even remember exactly. We ultimately were able to send a letter through a package that was already being sent through the health system with permission. How we did that.
Yeah, I think it was because I was a clinician, I know the patients, so I think for this role we bent.
Yeah.
And so the letter came from me more or less, sending it out. We can argue now, is there conflict of interest? But it was just sending out the information.
Well, I think what made that first letter easier actually to navigate was that it was not a research project to start with. It was a clinical improvement initiative. So a letter could go out anonymously that, if you engage with the clinic, receive a letter, you choose to respond if you want. We're planning on holding this shop. And then from that, we were able to ask who wants to stay in touch and who doesn't. Well, initially, everyone wanted to stay in touch. I think we maintained just a fairly consistent contact with about half of the families that came.
That's true, it wasn't, that's actually, I think it was not.
I have a question from someone online. They asked, looking back, would you have still held your session with children and youth age 18, or would you have come for you one for children?
I'd say the latter. I don't know that we would have wanted to silence younger voices by not including them. So yeah, probably still include them, but separate the groups and have different activities. Yeah, and now we know how much our youth are just ready to talk. I think we just would have had a lot more, youth-based opportunities.
Anyone else have more questions? That was extremely powerful. Thank you so much for sharing your experiences, all of you. Yes, join us April 12th is our next lunchtime learning on unconscious bias and patient engagement. So it'll be interesting. There's some activities to do ahead of time. Thank you all for coming. Please sign in and give us an evaluation. Let us know how we did. And thank you so much for our presenters.